Folks, the American Health Care Act is on life support, and the plug is getting ready to be pulled on it. In an attempt, excuse me, to resuscitate this particular bill, because a vote is scheduled on the bill today, guess what? The leadership and the president are at the current moment dickering away benefits. Now, in the Affordable Care Act, there were essential health benefits that were mandated to be provided by insurance companies. Things like pre-existing conditions, obviously, but specifically maternity care, newborn care, things of that nature. The Republicans are willing to strip 10 major features out of the essential health benefit law in the ACA in order to try to pull in more of the maverick, call them maverick, more of the hardcore far-right Republicans. This is a bunch of hooey. People, do you actually know what insurance is? Insurance is a company that is gambling that you will not utilize a benefit. And you, by buying insurance, are placing a bet that you will utilize the coverage. Now, how the insurance companies get over, and you are going to have to find me one insurance company that actually loses money. What ends up happening is they end up making less money than they project to make. I refer you back to the earthquakes in California. I think it was about 30 years ago, where an insurance company, Liberty Mutual, had provided a tremendous amount of earthquake insurance along with other companies. Well, that year when they had that particularly devastating earthquake, the cost that Liberty Mutual incurred from that earthquake, they basically took a $1 billion hit. Okay, $1 billion is what they ended up having to pay out to cover all of the claims. Now, they took a look at that and decided that they were going to get out of the earthquake insurance business in California, which they did for approximately 7 years. And then they realized that they were not making the money that they really needed to make. Now, let me refer you back. When I said they took a $1 billion hit on paying off the claims, that particular year, they still made profit of $300 million after paying out all of those claims. And though I don't have the specific numbers, my sense is that the other insurance companies took some major hits as well, and they all still made money. Now, most insurance companies, the major ones, your Allstate, your State Farms, etc., they continue to sell earthquake insurance in California, but they raise that particular premium rather high. And I was one of the ones who owned a home in California at that time. Liberty Mutual got out. I had to find another insurance company that provided insurance, earthquake insurance, which I was able to find. As a matter of fact, it was Allstate. And let me tell you, Allstate is not one of your cheaper insurance companies, but they did provide earthquake insurance, and I turned around and paid a higher premium, and we didn't have any more earthquakes for, I don't know how long, and I never placed another earthquake claim. So all of the money in my premiums, as well as others, basically was bumping up Allstate and State Farm and all the companies that stayed in the earthquake insurance market. Liberty Mutual saw all of that money going to the other insurance companies, and guess what? They went right back into the market, and they are in the earthquake insurance market to this day. Well, health insurance kind of sort of works the same way, except what health insurance does is it spreads the risk out over a huge pool. So women more than likely are going to get pregnant and have kids. But not all women are going to get pregnant and have kids. Men, however, are never going to get pregnant and have kids. But men are the cause of women getting pregnant and having kids. So the risk pool for pregnancy should be spread out over both parties that are responsible for the act. Once a child is born, a child is just that, a child. And its parents, male and female, are responsible for it. So, of course, they should be responsible for paying health insurance, number one, to cover the kid, okay, and number two, because they were responsible for the kid. Now, that's just an example, and I could probably go down the line for all of the essential benefits that they want to get rid of. Things like emergency room care. How many times have you actually used the emergency room if you have insurance? Odds on favorite, not a lot, because you're probably going to your doctor, seeing that doctor, which is cheaper, getting a prescription, getting it filled, and going about your merry way. Well, they want to strip away emergency room service from the American Health Care Act. They also want to strip away prescription coverage for the Emergency Care Act. They also want to strip away treatment for substance abuse and mental health. They want to strip out a lot of the things that are more than useful to a lot of people, though not all of the things are useful to all of the people at the same time. Look, folks, Obamacare does have its faults. I should say the Affordable Care Act does have its faults. But for the most part, it's a good thing, okay? Does it need a bunch of fixes? Yes, it does. And if these guys would ever get their heads out of their behinds, get together and deal with the fixes, we would be in a lot better shape. But because the Republicans have campaigned relentlessly over the past 8 years about getting rid of Obamacare, the Affordable Care Act, now these guys have their backs up against the wall. But they can't take a step forward because the quote-unquote fix that they want to put forward is worse than the quote-unquote disease they claim the Affordable Care Act is. It's a doggone shame that these guys can't sit down, figure out what works as far as the Affordable Care Act is concerned, what doesn't, fix the stuff that doesn't, and keep us moving. Now, as far as mandates are concerned, I just heard that they're also talking about removing all mandates and dropping those down to the states. Well, either the federal government's going to mandate or the state's going to mandate. But now what happens if one state, let's take California, mandates something, whereas Arizona decides not to mandate something? And these guys get their way and they allow insurance to be sold across state lines by federal mandate. Well, you're going to have a hell of a lot of people in Arizona that are not going to be buying insurance in Arizona. They're going to be trying to buy insurance that's located in California. Okay? Now, I'm not exactly sure how long that would work, because more than likely the insurance companies based out of California would start complaining, and California would make a ruling that out-of-state residents could not buy insurance in California. It turns into a huge mess. So again, it looks like this bill is going down later this evening. I only hope that it does, so that these guys can finally sit down, and hopefully Republicans, Independents, and Democrats can figure out what works best for the country, not for their own political agendas.